As a caregiver, I want to share my journey. Sometime around age 5 or 6, my dad was diagnosed with lung cancer. It was so severe until he stayed in the hospital probably for about 1 year. And the cancer was in remission for about 20 years, and he passed away in 1986. So my dad was a single parent. He was not able to speak. He lost his vocal cord. He was able to hear, but he was not able to speak. And when he passed away, I had to raise my younger siblings. Then in 2023, my oldest brother was diagnosed with lung cancer, and he passed away January of 2024. So sometime back around 2016, my youngest brother, he's autistic, had a stroke. So he was referred to a hematology specialist. So he saw the hematology specialist for a while, and they noticed that his white counts were pretty low. Well, they said it was pretty common sometimes for African American people. But they really didn't have a base to follow, so they continued to watch it for a while. We got to a point where they even stopped seeing him. And the primary physician, she would watch the numbers and she would refer us back over there, then they'll release it. And it was kind of a back and forth for quite some time. So these last few years, I decided to look up some things to see if dieting would help him regulate those numbers. And it did. So I had a friend of mine to start preparing meals for him. So things like beans and greens and certain types of meat helped to raise those numbers. The year before last, the numbers started to decline again, but I noticed a pattern. Whenever he lose weight, like in the summertime, his numbers would drop. If he gained weight in the wintertime, his numbers would rise. So in 2023, the hematology specialist wanted to do a bone marrow test, and I've heard all kind of horror stories about that test. I didn't really want him to do it if it were not necessary. Well, late 2024, his numbers dropped again, and this time I decided to go ahead and let's just see if he has it. So they did the bone marrow test in October of 2024. He did well with the bone marrow test with local anesthesia. I've heard horror stories about it, but he did really well. He said it was just like a little pinch, and that was all, just in case somebody want to know that. He did come back confirmed hairy cell leukemia. So hairy cell leukemia is very rare. Only a handful of people in the whole entire world has this. It's very rare. So I started searching things and trying to figure out what in the world is it about this. So I decided to come here to make a video because just in case somebody's like me searching for answers. But I was still concerned about his numbers fluctuating. That just didn't make a lot of sense to me. And my brother's autistic, so as the doctor's talking to him, like, I just need you to talk to me instead. So he knew that I had this concern. He said, okay, I think you may need a second opinion, because I was not ready to do chemo, because he said the way to treat this is via chemo, and I just wasn't hearing it because I still was not understanding why his numbers would fluctuate. So we went over to Kirkland Clinic. That's where we saw this last doctor, and it was a pretty amazing experience. They explained to me that it has been confirmed that he had hairy cell leukemia, and here is the plan. So the doctor told me that my brother would have to have 8 weeks of treatment, 1 full week of chemo. The first day he would have chemo and infusion called Rituxan. And throughout the rest of the week, it'd just be chemo. Then the next week, it would be the infusion for a total remaining of 7 weeks, 1 time per week. So he told me that the treatment would last, the chemo would last 2 hours, and the infusion would last about 6 hours, is what they told us originally. So this is what happened on day 1. We arrived around 11 o'clock in the morning. They called him maybe about an hour later. He got in and they drew blood. And while we were waiting on the blood results, we had to talk to the nurse, we had to talk to the pharmacist and the physician. And they were explaining the whole entire process to us. And they gave us handouts, thank God for that, because it was hard to keep up with all the things. So of course my brother wasn't understanding, but I was there to take in all the things that they explained. So that whole process took a little while. So they didn't actually start his treatment to about 3:15 in the afternoon. It lasts 2 hours, just like they said. Then we had to go into the next one. Now, before they gave him the chemo, they did give him some for nausea, which is great. I didn't want him to get nauseated. Going into the infusion that same day, they did not know how he would respond to it. So they did it gradually. And prior to giving it to him, they gave him some Benadryl, Tylenol, and some steroid before the treatment. Then they had to wait for about 30, 40 minutes to see how he would respond to that. So because he did well with that treatment, it didn't go as long as they originally planned. They said 6 hours, but it was actually more like 4 hours. But nevertheless, the day was long. So I would say if they, whatever time that they say, add, and if they say 8 hours, add 3, 4 hours to that. If they say 4 hours, add 2, 3 hours to that. Just be prepared for a lengthy day. Now the things that I was not prepared for were accidents in the car. But I did take garbage bags, paper towels. I did not have Clorox wipes because sometimes they may have an accident. It could be the nausea. In this case with my brother, he had intense pressure on his bladder where he could not hold his urine. He actually had an accident in the car. But thank God for the garbage bags and the paper towels. So when I got there, we talked to the doctor. The doctor said that was kind of normal for all the fluids that he was taking in, and plus the steroids made him have that increased urge. He said he guaranteed us that once we got past the treatment, he would go back to normal there. So because of the type of cancer my brother has, he's high risk to have an infection. So I have to check his blood pressure. No, I had to check, not blood pressure. I have to check his temperature every day. They gave him medicine that he has to take for infection to fight off beforehand. They also gave him some medicine to avoid shingles, and they gave him medicine for nausea just in case he needed. The nausea is medicine as needed, but the other ones he has to take the medicine for shingles to take that every day, twice a day, and for the infection he has to take that 3 times a day. But I got a thermometer that I can monitor here on his head. Because he's autistic, I just have to ask him every day, are you okay? Are you okay? Because he will not tell me otherwise. So that medicine that they gave him to avoid nausea is Zofran. I could not think of the name of that. But it's a bit of a challenge when you have somebody who's autistic. My brother's 55 years old. He's autistic. He's sweet as he can be. So they've been really sweet over at the place. They give him snacks and they give him blankets because it's super cold in there. They have a TV in there, but he's been working little crossword puzzles in there. But I stay in there as long as I can. Now, one day, the nurse forgot to give him, well, she was getting ready to give him the chemo, but forgot to give the Zofran. I was glad I was there. I said, look, did you give him the Zofran? So make sure that you are there with your loved one just in case they're not in the situation where they can speak on their own. So we have completed the first week of chemo and infusion. So we start tomorrow, the second week. He has a total of 8 weeks. So hopefully it's late in the day. It's like 3 o'clock in the evenings when we start. So this will be a new situation for us with just the infusion only. But because he had that accident in the car, they did give us a urinal, and I got the Clorox wipes, and we also got the pens. One of my customers brought the pens. You know, being that I work full-time for myself, I had to clean my slate to make sure that I am there with him the whole entire time. And I'm so grateful to have the position to do that, because I wasn't in that position when my mom got sick. When my mom got sick, I actually lost my job for 37 years because I chose to be there with my mom for 3 months in the hospital. So I'm grateful that I have my own business as a Sensi consultant, as you see. Glad I have my own business so I can not have to worry about my time. I can be there with my brother.